Osteoporosis is a silent condition, but it can be the source of much stress and worry. How do you know if you're doing enough or too much? Take the stress out of exercising with osteoporosis or to prevent osteoporosis by exercising well, not stressed, using the Be Well Now method. It starts by knowing that bone cells are constantly being made and die off. Up to age 30, you're making more bone than you're losing bone. But after age 30, you can preserve what you have and be proactive at preserving balance and strength and agility to make sure you're lowering your risk of fracture. But this is a whole person issue because often the fear about fracture limits us even more than the process of bone loss itself. So we use the Be Well Now method to make sure that you're doing a whole person solution. The B step is meeting yourself where you are, acknowledging that you have fears and challenges about that, and also acknowledging what you're doing well. And just checking in and meeting yourself right where you are with a little self-assessment, assessing your balance, your bone strength, your agility, your power, all of those things to see where you're at right now and get very specific about what you're going to do for exercise for bone strength. But then the well step ensures that your motivation is fueled by what you value, not by fear. This is a really important piece. You could be exercising in the stress state. Exercising in the well state is when your source of motivation comes from what you value and exercising in a way that you feel and function better now. And that leads us to the now step, doing a balance of mobility, strength, and stamina in the right balance, and specifically using those types of exercise, incorporating the evidence-based prescription for exercising to optimize bone strength. Learn more at the link below at exercisingwell.com.